Both serotonin syndrome and neuroleptic malignant syndrome share key symptoms, such as fever, tachycardia, and hypertension, which often complicate accurate diagnosis. Unfortunately, these overlapping symptoms do little to distinguish between the two conditions. However, profound diarrhea specifically indicates serotonin syndrome and is absent in cases of neuroleptic malignant syndrome. This particular symptom can serve as a critical differentiator during clinical evaluations. Moreover, clonus, a hyperreflexive condition, is a defining feature of serotonin syndrome. In contrast, neuroleptic malignant syndrome is marked by lead pipe rigidity. Recognizing these distinctions is essential for healthcare professionals. Additionally, understanding the difference between rigidity and clonus is crucial. Rigidity pertains to muscle tone, while clonus relates to reflex actions. This distinction significantly aids in achieving an accurate diagnosis. Elevated creatine kinase (CK) levels and increased white blood cell counts serve as vital indicators for diagnosing neuroleptic malignant syndrome, often confused with infection or rhabdomyolysis. Thus, awareness of these markers is imperative for healthcare providers. Symptoms of serotonin syndrome, including diarrhea and nausea, closely resemble those experienced when initiating SSRIs, though they are markedly intensified. This resemblance underlines the importance of diligent monitoring for patients on these medications. The relationship between antipsychotic medications and extrapyramidal symptoms emphasizes the risks associated with muscle rigidity. Neuroleptic malignant syndrome considerably exacerbates these particular effects. Gaining a solid understanding of serotonin syndrome is vital, as it exhibits symptoms that overlap with neuroleptic malignant syndrome. Notable symptoms include diarrhea, hyperreflexia, and heightened muscle activity. To aid in memorization, the mnemonic SS for serotonin syndrome effectively recalls its symptoms, evoking the imagery of a boat that cannot stop. This visualization is helpful in remembering key characteristics of the condition. Serotonin syndrome can arise when patients treated with SSRIs or SNRIs receive certain antibiotics, potentially leading to severe symptoms. Thus, awareness of this interaction is crucial for healthcare providers. Historically referred to as neuroleptic syndrome, neuroleptic malignant syndrome is linked to antipsychotic medications and presents symptoms such as muscle rigidity and elevated white blood cell counts. In summary, distinguishing between these syndromes hinges on recognizing key symptoms like diarrhea for serotonin syndrome and muscle rigidity for neuroleptic malignant syndrome. Understanding these indicators facilitates faster diagnosis and more effective treatment.